So now we're going to extubate the patient. He has passed all of his weaning trials, SBTs. He's meets the criteria for coming off of the ventilator, which is they're better and they don't need to be on it anymore, or we are ethically taking them off so that they can pass peacefully. You'll have either one. So what you need is some paper towels or a cloth of some sort to put the tube on when it comes out. You need suction and a syringe. We are all set up to the ventilator and everything just like normal, so I need to disconnect my CAS. Before I do any of that, I have my large volume nebulizer set up with a mask, and I will have the FiO2 set to the FiO2 he's already on. So we extubate to cool mist. So before I start deflating anything or doing anything, I'm going to disconnect my CAS. I am now going to suction the airway well before I deflate the cuff, because we don't want any fluid going down into the airway. So, all right, I do it as many times as I think necessary. Then I will disconnect my Ballard and connect my Yonker, and I'm going to suction the upper airway like we've done in all the other videos. All right, put that off to the side. The patient may want to hold it as soon as they're unrestrained. So now I have done all of that. I'm going to deflate the cuff completely. And now I am going to remove the tape. Alright, I'm going to tell the patient to take a deep breath and cough, and he's going to pull it out quickly. Put the tube and everything down on the napkins you have laid out. Get your oxygen, put this on him. I'm going to listen. Should have listened before I pulled the tube out when I deflated the cuff to make sure that there was a leak, and I forgot. But you are going to listen for stridor. You want them to say something short, their name or something, but then remind them not to speak a lot because we don't want the vocal cords to swell. So my mistake was, before I extubated him, when I deflated the cuff, I should have listened to make sure that there was a leak and that there wasn't swelling around the tube. Because if you deflate the cuff and you can't hear anything, then there's swelling and you should not extubate. So I put him on his oxygen. I have assessed for no stridor, which I will continue to assess periodically, depending on the protocol at your hospital, every 15 minutes, then an hour, so on. Clean up my mess and go home.